Introduction: a look at the statistics. Migraine is a common and often debilitating condition that affects over 28 million Americans. 1 in 4 households have at least one migraine sufferer, with the prevalence of migraine being higher than asthma and diabetes combined. It is estimated that 18.2% of women and 6.5% of men between the ages of 25 to 55, the most productive years, suffer from migraine's disabling effects, interfering with their overall quality of life and regular daily activities. With such high prevalence and impact, it is surprising to see that data from the American Migraine Study 2, conducted in 1999, shows that only 48% of the 28 million International Headache Society IHS-defined migraineurs reported having a physician diagnosis of migraine, leaving the remaining 52%, or over 14 million migraine sufferers, undiagnosed. Why do over 14 million migraine sufferers remain undiagnosed? American Migraine Study 2 data has determined that substantial proportions of undiagnosed migraineurs are diagnosed with other headache types. In fact, 42% of these undiagnosed migraineurs reported receiving a diagnosis of sinus headache. This is of importance when considering the medications typically prescribed to treat these two distinct conditions. Triptans are commonly prescribed for migraine, whereas antibiotics are commonly prescribed for sinus headache. Although sinus headache is a common diagnosis, specialists consider sinus disease to be a rare cause of recurrent headache. Given the need for conservative use of antibiotics, it is important to further examine why so many migraineurs in the United States are diagnosed with and treated for sinus headache. Join us as we review the new clinical and pathophysiological data showing that symptoms commonly interpreted as sinus headache may actually be migraine.